Good afternoon, everyone. Just a year ago, when we were getting ready to open the fall term, a little we would have imagined how the next year was going to be, and here we are at a quite different beginning, the beginning of this particular year. Even 6 months ago, when the pandemic set in and we started making all the adaptive measures, we did not know what to expect, but as a university, we have pulled together. We graduated more than 750 students last year. So there are so many good things that we have accomplished that we should be collectively proud of. And this all happened because, again, so many people contributed. One of the things I did in the late spring term, I got to speak with a sample of our students, 20 or so. I also met students on campus in Klamath Falls while I was walking around. And they truly expressed an overwhelming desire to return to in-person classes, not just because they love that experience, but they also do want to do so because how it affects their progress with the curriculum as well as the graduation. So it's a combination of the above factors, along with our own commitment to student success, how well we work with the community, the low incident rate in Klamath Falls, the adherence to safety and health guidelines on campus, our planning, how the community feels. There are so many factors, and most of all, my deep faith in all of you in terms of how we are able to help and guide our students and support them and each other. That is motivating us to open the fall the way we are planning right now. As for the format of today's forum, we have students, parents, faculty, and staff given the topic, and we are going to stay focused on the fall reopening topic today. In regard to laboratories, as you may know, the professions that we teach rely heavily on hands-on training, and that is reflected in how students have enrolled. We will focus only on the fall reopening questions and comments, and in many cases, we would be synthesizing similar questions into one so we can answer as many of the comments and questions as possible. So I want you to know if your specific question is not repeated verbatim, because we are trying to address as many of them. It was also very encouraging to see many questions that have come from many of you, in particular the parents and students, and we want to be sure to address them today. We could put them in three categories. One is academics, finances, as well as the general safety and health protocol and related measures. I hope at the end of the hour, you can get a better feeling of how well we have looked into preparing for reopening this fall and the various contingency measures that we are continuing to develop. As you can imagine, we continue to get updates from various agencies on a daily basis. So, and we are paying attention to that as well. So as we begin, I have a few additional opening remarks. After that, I'm going to request our provost, Dr. Mott, our vice president for student affairs, Dr. Foley, to share their opening remarks, which will also address some of the questions that have come our way so that hopefully you can get a lot of answers in their opening remarks. In addition, with us today, participating live is Galen Mora from our Student Health Center, as well as Maureen DeArmond, our Associate Vice President for Human Resources. So they can also take questions in their respective domains. The good news is, as planned, in terms of the physical residence that we are asking students to be on the Klamath Falls campus, it is going to be 8 weeks. After that, there will be lower density. Only a handful of students will be coming back for the remaining 1.5 weeks. Many of the exams and others are going to be taken remote, and Dr. Mott will provide more details in that particular regard. In terms of looking at the enrollment pattern, Dr. Mott and the academic leadership have done a lot of changes. About 50% of the lectures are being offered remotely, and the remaining 50% in person. We also have many of the laboratories, of course, being offered in person, like 90% or so. So that is, again, in terms of how students have enrolled, only about 2% of the students in Klamath Falls have chosen to sign up for only remote set of courses in all the courses they are taking. So some of these things we understand will be changing over time. Now, Oregon Tech staff are continuing to work with public health officials when there is a positive case on campus, but public health will be doing all the contact tracing. You can ask more questions. We have the experts here to answer those questions, how that works. An important addition today is that we are now trying to frame some additional testing possibility for the Klamath Falls residential students. They are going to be a large percentage of what we have on campus attending, participating in the residential campus. We are still working through all the logistics, and we are trying to do it on the campus itself so that it is convenient for the students, since many of them may not have the transportation to move around. Of course, we are continuing to work with our community health partners in this particular one. So these are some of the quick items I wanted to address in my opening remarks. We will continue to address other items within the call, but ultimately, I want everyone to remember that our university exists to provide the best education possible for our students, and we are committed to doing it while protecting the health and safety of our entire community. And this is obviously an evolving situation. We will continue to adapt. I hope with everyone's cooperation and responsible participation, we will have an opportunity to prove to ourselves, as well as to all of our key constituents, that we as a university have been able to be successful this particular fall. And I look forward to working with all of you. With that, I'm going to invite Dr. Mott, our provost, to speak, where she will address questions relating to the academic side of the house. Dr. Mott.
So yes, good afternoon, everybody. As most of you know, but just sort of to recap, we've been working on reopening plans since spring, and Erin Foley has been leading the campus-wide reopening committees. We've had a separate academic reopening committee, and the deans and I have been meeting with the chairs regularly, and I've been working closely with the Faculty Senate President as we've developed the plans. We have two different plans for classes this fall based on campus location. There have been messages out about this. At Portland Metro, given the pandemic conditions in the area, we'll be teaching lectures through remote delivery, but labs will still be in person. If conditions change, we'll be asking faculty to move labs to remote delivery, and the allied health labs being the last group that would be changed. At Klamath Falls, with the lower infection levels in the area and the county at phase 2 of reopening, we're planning for in-person lectures for lower division classes to provide new students the opportunity to interact with faculty and have a campus experience, and remote delivery for most of the upper division lectures. Labs are again planned in person for the hands-on experience. There are a few exceptions, and if students want to look at where their classes and how their classes are going to be offered, the registrar's website has a class schedule search, and you can see on there it will say remote if it's a remote delivery course. And again, if conditions change, we'll move towards remote lecture and then remote labs as needed. I know that people have safety concerns, and rightly so. Recently, there's been a lot of national news about positive cases on campuses. Most of these are at large state institutions with 25, 30, 50,000 students. So I think we need to be a little aware that we're in a very different situation with less than 700 students in residential halls on campus. We are watching some of the comparable smaller institutions in Oregon. Willamette University has been open, has only had 1 student and 2 employees test positive, and they were all asymptomatic. Corban University has no confirmed cases. They've got a couple that are waiting test results. And Linfield similarly has had no cases on one campus and less than 5 on the other. Obviously, we'll be watching that and seeing how things develop on those campuses and learning lessons from them. I think another example that demonstrates potential success for us is the fact that we have had in-person labs, both at Portland Metro and at Klamath Falls this summer. So a couple of the questions that have been submitted. If a student is quarantined, how will they continue in their in-person class? They should contact their instructor, who will provide recorded lectures or other materials to keep them up to date while they're unable to attend. Why are some classes being held in person while others are remote? I think both Dr. Nagy and I have sort of said this already, but we've heard clearly from admissions counselors, from the housing deposits, from talks with students, that freshmen in particular are looking for a campus experience where they can work directly with faculty and learn using in-person labs. So by offering 100 and 200 level courses in-person format, students can have this experience. And then by having the upper level lectures through remote delivery, we're reducing the density of students on campus at any particular time. Have pass, no pass options been considered? We did consider this in the spring, and faculty senate feedback at that time was that the faculty were not in favor of converting to pass, no pass. We watched students' progress very closely the first couple of weeks, and we had positive feedback from the majority of students were handling the remote delivery well, and we didn't see the need to revisit that at that time. Will face coverings be required in classrooms? Yes. Faculty will have the option of using a face shield for teaching instead of a mask, so that students who are hard of hearing or may need to be able to read lips will be able to see that. Will curriculum be adjusted by the professors to deal with the new and tougher learning challenge? Student learning outcomes for a class will not be changed, but our faculty are very sensitive to student needs. And if as a student you're having difficulties, I encourage you to reach out as soon as possible to the instructor, to our advising resources such as the ROC, or to student services. Are faculty being allowed to teach remotely if they have concerns? For medical accommodations, we are of course providing whatever accommodation is needed as requested through HR. Other faculty have worked with their chairs, and at this point, I've been assured that any faculty member who has asked for flexibility has been able to work within their department to find a path that will meet their needs. And those are really a summary of the questions that came in up to now, and I'll be glad to answer other questions once we've passed it on to Vice President Foley, who's going to talk about all the rest of the issues that are non-academic. So hers is much more comprehensive.
Just a little longer. All right, so let me start with some general points about how campus will operate due to COVID. Oregon Tech announced in June that the goal was to move into phase 2 beginning September 1st. Well, today's September 2nd, and we are in phase 2. So what does that mean? Well, we'll have more people returning to work on campus. We'll have more in-person services, and those will continue to ramp up as we get closer to the start of classes on September 21st. Of course, we are still limited by the governor and OHA and HEC and anybody else that weighs in, and we have to follow all state requirements that limit gathering sizes and other activities, which could change again between now and September 21st. Every campus community member plays an important role in how we operate this fall in order to have in-person classes and services. The decisions we each make to follow the prevention measures we've put into place are important on campus, but also when it comes to what we do off campus. It's important that we each do our part. If we all do our parts, we will not be the next university to make the national news. Training for students, faculty, and staff on expectations, processes, procedures will be conducted over the next 2 to 3 weeks. Campus will look a little different this fall, and here are some examples. Signage. There will be lots of signage posted to serve as reminders about various prevention efforts like face covering requirement, physical distancing. We're going to implement a walk on the right side of the hallway so that you're not interacting with others. So stay to the right, just as you do when you drive. Stairwells may be limited to either up or down. For example, in the College Union, we'll have two stairwells on the end going up and the center one being down only. Plastic barriers at service counters at other locations By now you've seen them around in retail locations. There will be less furniture in common areas. The number of people in some campus spaces will be limited as a result of the sector guidance. In some cases, they will be asked to follow a flow of traffic rather than moving around at will. A COVID compact and our Stop the Spread pledge, that's a tongue twister, that will set expectations for campus will be emailed out in the next couple of days. Other procedures will be shared. So it's really critical that you pay attention and read these emails. The face covering document, or face covering requirement rather, that started mid-June is still in effect, which means anyone on campus must properly wear a face covering or acceptable alternative. Students, faculty, and staff will receive 2 Oregon Tech cloth face coverings. Aren't they nice? Through a distribution process that was initiated a couple of weeks ago for the faculty and staff, students will be able to get theirs during housing move-in at Week of Welcome activities or my office for students in Klamath Falls. Portland Metro students, you can pick up your face coverings at the main front desk. All right, let me move into some specific areas of campus, starting with housing and dining, and then I'll move to campus activities. So for housing, following comments pertain to students living on campus in Klamath Falls, since campus housing is not available at Portland Metro. In providing housing this fall, our plans align with the guidance of the CDC, Oregon Health Authority, HEC, and the Governor's Office, and includes things like move-in information with your housing assignment went out mid-July. You have an assigned time for student to move in. We also, in order to manage the number of people on campus at any given time, are limiting students to have only two guests assist them with move-in. More housing information will be sent directly to those students in the next 2 days. Dr. Nagy mentioned the change in the calendar and Thanksgiving being, after Thanksgiving being more remote. Housing will remain open from the period of Thanksgiving through the official end of fall term. Face coverings are required for anyone on campus, including the housing areas. So any guests assisting students will also need to wear a face covering. Roommates will be considered a quote-unquote family unit after 14 days and will not have to wear a face covering in their space unless there are guests. In the next day or two, students with a housing assignment will be sent a screening form about COVID-19 exposure. This form will need to be completed in order to move into campus housing. Student health staff will review for levels of risk and will follow up with the student directly. This needs to be completed within the 14 days of coming to campus to move in. Other actions related to housing. The buildings will remain locked 24/7, with any guests being met at the door by the resident. Posted procedures for using laundry spaces, kitchens, bathrooms, showers to reduce the number of people in the space will be posted at the appropriate location. Seating also will be reduced in common areas and lobbies within housing. Signage throughout the facilities will indicate expectations and proper procedures. Enhanced cleaning of shared facility spaces and high-touch surfaces. Hand sanitizer stations will be located throughout the buildings, and each student will get a small refillable bottle at check-in. Social activities will occur in person with limits on the number of participants, as well as through virtual events. Community meetings will provide lots of instruction around living on campus in the COVID environment. Let me shift now to dining. The main cafeteria on the Klamath Falls campus is the Marketplace. It will look different in the fall, primarily in reduced number of tables and chairs outside in the Cascades area. Within the Marketplace, there will be no self-service within the Marketplace. There will be staff to assist in serving. The flow through the area will be in one direction only, so you will enter and move in the direction of the arrows. I don't know if that'll be clockwise or counterclockwise yet. Subway, unfortunately, is no longer an entity on campus, so we will use the vacated subway space to support dining services and to help with this service challenge with the COVID requirements. There will be carry-out options. Other dining venues across campus will also operate differently pending county health requirements. The farmers market program, where students can order fresh and bulk items, will still be available with specific order dates and pickup dates. Communities within housing will be assigned a meal time. That's for dinner specifically, and that's done in order to manage numbers. So a student, if you miss a meal time, your allotted meal time, don't worry, you can still come in at the end of the shift and be able to eat. All right, COVID-19 health and safety issues. We've worked with the county public health officials in developing our plan for the fall and in response to any positive COVID cases. Oregon Tech's plan for the fall term is available on the webpage. That's the coronavirus webpage and the reopening webpage. I would encourage you to look at sections 6 and 7 specifically, starting on, I think it's page 67 for the protocols in response to a COVID-19 positive case. As mentioned previously, students living on campus must complete the screening form in order to move in. So once classes start, students will be asked to do a daily health check through the Oregon Tech app. This will review symptoms, and if you have symptoms, you'll be instructed as to what to do. If you don't have symptoms, you'll be given a green health check pass, which will allow you to be on campus. Employees are also being asked to self-monitor for symptoms before coming to campus. Bottom line is, if you are having symptoms, then we do not want you to come to campus. Information about the app features and expectations will be distributed and be a part of the student trainings. Additionally, the Oregon Tech app will have a feature for students to use a QR code and scan into various locations around campus, like classrooms, labs, library, tech rec, and other public spaces. So if in the event of a positive COVID case, we can assist with contact tracing. If a student has symptoms, they are asked to contact Student Health for directions and testing. All testing after the on-campus testing will be done through Sky Lakes, not at Student Health. A student that lives on campus will quarantine on campus if needed in rooms held for this purpose. A student in quarantine will get meals delivered and will be monitored by Student Health staff. Since the flu season will also arrive come fall, we strongly encourage students to consider getting a flu shot in October. Flu shots will be available on campus by Student Health medical staff. If a student living on campus needs to be quarantined, they can do so in the space designated within housing, or they can return home. If when a positive case occurs in housing, cleaning of the spaces will be completed in a timely manner. All right, let's move on to another topic. Campus activities, what will that look like? The week of welcome will be a very different experience this year due to COVID. Although some sessions will be in person with appropriate physical distancing and other precautions in place, a number of the sessions will be virtual. New students will need to make a little bit more of an effort on their own to get connected to campus, which is an important part of being successful. Activities will be held on campus in ways that meet our requirements for health and safety, with lots of virtual events as well. Fall sports were moved to a spring season. Other sports, well, all sports, each sport is developing what it will look like for practice, which can resume as early as September 21st. So athletes, listen to your coaches for directions on those protocols and your dates. Campus clubs and programs will have opportunities to meet and hold events, but all activities must follow the COVID restrictions. Tech Rec, the new fitness center, will be open beginning September 21st with modified operations and cleaning protocols in place for all users. Whew. You need to take a breath.
Very good. Well, thank you, Dr. Foley. I think that is in summary of responses to the various questions we have received so far. And you could see this is really a synthesized answers, because some of the questions were very similar. But one of the things, Dr. Foley, I would like to say is all this granular planning, they are going to be successful only if all of us follow those protocols. So could you talk a little more about that pledge?
Yeah, so the pledge, it's really a pledge to yourself, a pledge to our community, and a pledge to the larger community. So it's succinct, it's one page, it'll go out next week. It'll be some of the same things we've talked about in terms of prevention measures, hand washing, symptoms checking, face coverings, physical distancing, keeping things clean, like washing your masks regularly. Those types of things that should be pretty easy for everybody to do, but we need to be mindful to do them regularly, like daily.
Well, again, every one of us can follow the protocols, the better the outcome is going to be. We are beginning to get now, we are open to additional questions from outside. The first question is regarding transportation from the school to the train. So could you talk a little bit about transportation in general and the specific question?
So from the school to the train, so that sounds like it's a student who's living on campus that needs assistance with transportation. So yes, we've been able to accommodate requests to the train station. So contact either me or housing, and we'll see what we can do to assist with that.
And there are also bus services over the weekend, or is there any such thing, any arrangement for students to go into town?
Yes, so through housing, one Saturday each month, they will arrange for students to be able to be transported across town, wherever, and picked up and brought back. So that type of information will be through housing to the residents.
The question is also about they're asking for some more information about the designated eating times. Could you kind of mentioned it is not all lost if they don't show up at the time designated. We don't want anyone to go hungry.
Right, so, we won't deprive any meals. So we have a limit to the number of people that can be in the marketplace at any given time. And so in order to stagger the influx of students needing to eat, we're going to assign a community at times. So your community will be like your floor, your wing, however we split it up. So you'll be given an assigned time for dinner only, and if you can't make that time, then you can come in right at the end of the meal service period and be able to eat. It just helps us manage the flow, and then it keeps maybe people less, more willing to come in and eat and not hang around, but when they come in and there's a long line and they have to wait forever, that's probably not a good process either. So it will manage the flow.
Another question has been, have the students been surveyed or faculty staff been surveyed, etc.? I know there have been many communications that have gone over the summer to the entire university community in different ways, and you sent, Dr. Foley, special communication to students. Dr. Mott has been sending regular communications to faculty. There are faculty reopening committees with faculty, staff, and student representation. Therefore, so there have been mechanisms to get feedback from these constituents. Could you talk about what are some of your experiences in doing this?
So we've always had the ask a question on the coronavirus webpage as well as the reopening webpage. So we've entertained questions through that, and/or questions and comments through direct email. So once the campus communication has gone out, whoever sent it out will get comments or follow-up questions, and those have been responded to, and then included if it's a training topic, that's coming up regularly. We've added it to future communications or those training sessions that we'll be rolling out.
Dr. Mott, do you want to comment about your conversations within the academic reopening committee and the consultation that has happened throughout the summer?
So yes, the consultation has been with the Academic Reopening Committee, includes faculty and chairs, and we've asked for feedback, each time we meet. We've met also with the chairs. The faculty have been off contract since mid-June, so we generally get, a pretty poor return from emails, so that has not been a formal survey done, but there have been a lot of opportunities for feedback, and of course we've been in close contact with Faculty Senate through this time as well.
Another thing is about the meals. They are indicated as all you can eat, or will that be affected because we have restricted times and different type of service for the students?
So we're still working through the details with the health department. At this point, it seems for each meal you'll be allowed to go in one time, but there will not be a limit on what you can pick up during that one entrance. So there will be to-go containers, so it's likely that you'll get to be able to fill up 2 to-go containers, say that quickly, and then 2 drinks, which will probably be distributed through the old subway space. So in the past, you've been able to go in and out, in and out, in and out as many times, but now we're going to have to limit that again because we can only have a certain number within the marketplace at any given one time.
And these are also processes you are going to be monitoring and see how it works and keep improving them.
Of course, yeah. We managed to figure out how to do it in spring, and so we will figure out how to serve even more students in the fall and make tweaks as we need to.
Well, you know, as I spoke with some of the students, the next question probably is for Dr. Mott. You know, they were very appreciative of the efforts of our faculty, even in some of the remote instruction. And this question is about the remote testing. And I will admit, one of the students had mentioned the testing was a little awkward for that particular student, but he also qualified it by saying that it's just me, whereas his colleagues were in a different assessment mode. So given that, are we looking to modify the process in some way? I know we are looking to have the final exams as remote as possible. Dr. Mott, have you discussed this with in the faculty academic reopening committee?
We have touched on it. We have not gone into a lot of depth on that yet. We are looking at, so finals will be remote, except for a few of the allied health areas that have to have in-person lab finals. And so those students will actually return to campus. They'll be notified early in the term by the instructor if that is the need. Everybody else will have remote finals. Of course, during the term, it'll depend if it's a face-to-face class or a remote class, how exams will be given. We are looking at different proctoring models. We're looking at ProctorU, and we're going to be sending out a survey to faculty about how many would need to use or would want to use ProctorU. It's a cost per student, so we have to have some idea of how many would do it. So we are looking into that. We are aware there were issues in the spring, and we're working on how we can adjust. And once the faculty are back on campus, we'll obviously be having a lot more conversations about that.
Well, thank you. The next one, you somewhat addressed it, Dr. Foley, with respect to change in the campus opening plans. And you said how important it is students and faculty and staff alike continue to monitor emails. Could you talk about how any change in plans will be communicated? We get to post many things on our reopening site, even if we communicate it by other means. Could you talk about it, please?
Yeah, so we can post significant changes to the web page itself. There will be obviously email communications of any changes that are significant. It will go to the appropriate group, so whether it's all campus or just students. The plan itself is amended, has been amended with protocols. So the plan will show the last date and then indicates what the change was. So you can easily see if you're looking at the plan what the most recent changes have been. So it's primarily going to be on email because that's the most direct way to get information out to everyone.
I think it's important people do see the emails, that way you get it in a timely fashion, and many of them do get posted, if not all of them. If it is reopening related or important things, we do post them on the reopening page or COVID page. So I think it is important you keep up with the communications. I know it's hard to sometimes, but look for Oregon Tech emails so that you can continue to monitor them. The next one is regarding cleaning. I know you, Dr. Foley, and you, Dr. Mott, you two walked personally through the buildings a couple of weekends ago. You kind of looked at the direction of traffic and many other parameters that influence classroom teaching. Are we able to share how the cleaning is envisioned now? Also, Dr. Mott, you and I have talk to other universities have been and learning from them and what is working well for them. So can you comment about the cleaning, either when a class starts and between classes?
So after classes each day, the classrooms will be cleaned. We're working with the custodial supervisors to look at how we're going to do that. So some details we're finishing up working on right now. There are going to be totes with cleaning supplies in each classroom. Again, in fact, today, is it today or tomorrow? We're meeting, I think, with you, Galen. I think it's today. Today, we're going to actually meet with the deans, and Galen and I are going to meet at one of the classrooms and look at specific protocols, how to use those cleaning supplies without having contamination issues with multiple people touching the various pieces in there. And so likely to be potentially the faculty spraying the desks, and then the students getting a paper towel and wiping their own desk and then disposing of that individually. But we'll be getting that clarified today and communicated out. And I think there was, along with that, there's a question about training sessions. And we will be talking about training, yes, when faculty are back. At convocation in the morning session, the deans and I will be having a session which will talk about some of the very specific classroom protocols and Zoom office hours and those kinds of things. And then in the afternoon, Vice President Foley and AVP Maureen Dermond are going to have training for each college that'll be offset in the afternoon during convocation. So yes, there will be a lot of training on that on the 16th when you all are back on campus.
Also, many of our faculty have already done this and done this well in spring, and I'm sure we are learning from those experiences as well. And our online staff have done a tremendous job helping our faculty during the term. So the next question, by the way, Galen and Maureen, if you have anything to add on the questions you heard so far, or if you want to answer something, please raise your hand. Also, the question is about classes on campus in Portland Metro, or only labs on campus, or what? How are we offering the Portland Metro coursework?
So the only classes that will be on campus at Portland Metro will be the labs. There are some lecture lab combined courses where those lectures may be on campus because they flow straight, from the lecture into the lab. So it doesn't make a lot of sense to do the lecture piece remote somewhere and then you have to turn around and be in lab right away. So there will be some exceptions where it will say the lecture is in person, and that's because there's a lab associated.
Okay. There is also next question. I'm not able to read it fully. So when will the halls, the buildings, Seaman Owens, etc., be unlocked on the Klamath Falls campus?
Unless there's a compelling reason, I would think we would not have those unlocked on a regular basis until classes start on September 21st. Those individuals that have offices in those buildings have access. So unless there's some other reason, I would say the first day of classes, the 21st.
So Galen, you have been working very closely with the community health officials here, county health officials, and they have been very helpful partners. So if there are issues, how does it typically work?
Well, basically, Jennifer Little is the director of the Klamath County Public Health Department here, and she's been really responsive. So we've been actually averaging a phone call at least a week. If we have questions, I relay them from the administration. If she has a question, she asks us. She was involved in reading and approving the reopening plans, as well as the updated protocols as we've been doing that. I'm also on a weekly call with the Oregon Health Authority, so there's a lot of communication happening. So I'm not sure if there's anything else you'd like to know, but they've been really good partners.
Another question is about really student living. If they end up leaving Klamath Falls for a weekend, is there a protocol we are recommending upon the return?
So we're encouraging students to come to campus during move-in and then stay in town for the remainder of the term. Now, will every student be able to do that? Probably not. It's more of what you do when you're off campus. That protocol is to obviously limit any potential for exposure. So large gatherings, bars, those types of activities where facial coverings are not the acceptable norm. Large groups, those types of activities, that's where the behaviors really need to be focused to avoid those. So then there's not a need to have a specific protocol come Monday when you return to campus. So it's more of making good decisions wherever you are at all times, whether you're in Klamath Falls, off campus, some other location. So
Yeah, the more precautionary steps we take, it's good for all of us, including ourselves. Another one is, will there be options, or actually will Fred Meyer have a student night like they have done in the past?
At this point, I have not heard that we will do the Fred Meyer shopping night. So that's one of the issues with COVID and monitoring and managing large numbers of people and what we're doing to maintain health and safety. So at this point, I have not heard that we will have a Fred Meyer night. That just means we'll want it back a year from now and more people will participate. So that's an okay thing.
Dr. Martia, you and the Academic Reopening Committee has done a lot of planning with respect to synchronous learning and synchronous teaching, how the classes are recorded, etc. We already had a question in that regard. So if a student has underlying health issues, will there be options for them to stay online? How does it work?
So the answer is yes. It's going to be fairly student specific in terms of, are they a freshman coming in? Are they a returning student? Do they have required labs that are in person? And so there's not a generic answer, really. There's a question for that particular student, how they wish to have the semester. If they are not if they are not coming to campus, there are going to be courses that are taught synchronously. Oh, I'm passing it to, no? Oh, sorry. There are courses that will be taught synchronously that will be recorded and will be available for them. If they're in a face-to-face class and they are ill, it will be like any other term. They'll talk to their instructor about how to keep up with the class.
Thank you. There are 2 or 3 very good questions, likely from students. One is about, will there be any cost savings because we are going through modifications? I know because in the housing and meal plans in particular, they are asking. I know we are maintaining the infrastructure so we can be full service. Could you talk about that, please?
Right. So at this time, the costs have not been altered, and not knowing what the fall term will ultimately end up looking like, the plan is that there is the fall housing rates and dining rates, and those will stay the same. Should something change, then we will look at it. But just like spring term, the change happened right between winter and spring, and those students that didn't come back spring, we didn't charge for. By moving the academic calendar forward by 9 days, we did not increase any of the rates by 9 days of additional housing days or meal plan days. So students are making up those days in advance for the days that they may not be here in person after Thanksgiving. So it's pretty much a wash.
The next question is probably for both of you. It talks about the ability to use the testing center for student exams. If so, can this be used during the finals week?
So testing is having some changes as a result of reorganization. And so that question is not clear in my mind. Students will still be able to test in the testing center, and those students that have accommodations for testing through disability services are the primary ones, or students making up an exam for some other reason. We will still accommodate that. For faculty members to send over an entire class to take an exam, whether it's a middle of the term exam or a final exam, will not happen. So I'm not sure I got to the exact question, but that's how we are operating fall and moving forward.
The next one is about wearing masks. I know wearing masks is as much our responsibility we are doing to protect others. On this one, talk about will the students wear the masks in the campus classes? Can faculty request them to wear masks throughout the class meeting?
And the answer is yes. Yes to both. If a student has a reason why they cannot wear a mask, there will be face shields available, but they will either have to wear a mask or a face shield. And yes, a faculty member can ask a student to leave if they are not wearing one or the other.
I think the next one is also an academic question. If they have underlying health issues, can they take, in this case, the anatomy and physiology laboratory? Can the students take the lab online? I know one of the reasons, based on student input, we have really made most of the laboratories in person.
Yes.
And so right now, will there be an option to take any of them online?
At this point, I believe not. I will certainly check on that. But my understanding is those classes will be in person unless the whole campus goes remote. And we did that in the spring, and the faculty adjusted to providing virtual labs. And so that would happen if the campus reverts to remote.
Dr. Foley, maybe the next question is for you with respect to the Green On-Campus Pass. It's the Oregon Tech app. Where can I find them?
So the Oregon Tech app is available through your phone's app store. You would just search for Oregon Tech and then download the app. And then right now you won't see any of the COVID specific features because we were still putting those in place. So download the app. You're new, so check out the app for all the other great features. And anybody can get the app, so you just have to download it for free through your app store.
For the next question on asymptomatic testing, are there any plans? The answer is yes. The focus is the Klamath Falls residential students. We are also working through the logistics with our health partner, so the testing can happen closer to the campus. So if they do not have transportation, that will work. And again, we are anticipating 600 plus students in our residence halls. So as you can imagine, we are focusing on the Klamath Falls students and residential students in particular, and trying to make it easier for them, recognizing they may not have transportation. Is there anything else, Dr. Foley or Galen, you would like to add? Okay. So the answer is yes, we are developing the plans and developing the details. The next one is about the Friday closure announced on the webpage on the testing center, and what are some of the operating changes that may be in the works right now?
So I think the Friday closures is the summer schedule right now. Come the start of fall term, offices will not necessarily be closed on Friday. Those, if an office is closed on Friday or has limited hours, those will be posted on their webpage as well as their front door, if you will, their office.
Thank you. The next question is about if you choose to do remote classes, if it's going to be like a regular online class. I know the faculty members are trying to determine the best way to teach the material. So the question is about the modality of instruction. I know they will vary depending on the content, what they're working on. Are you able to comment on that?
So For the remote delivery classes, they will not be taught the same as a traditional online course. They will, for the most part, be synchronous. So yes, you're talking about, I think about having a Zoom meeting for lectures. That will be likely the most common way that those classes will be offered. Obviously, the faculty will be looking at their best practices for how to teach those. We are asking that the faculty have at least some engagement with students each week, and we'll have Zoom office hours. They'll have maybe a discussion period where everybody is on together. So it'll be occurring in different ways, but the idea is that yes, there will be direct interaction between the students and the faculty.
Very good. The next one is really about one of the specific laboratories in ECHO. Will they have the ability to scan other students and the public? I know our medical imaging faculty did a lot of creative things so that our students could take the exams and do well. Our faculty, our TAs, and the students worked very nicely together last spring, and we heard a lot of compliments on it. So if we are not able to provide some of these answers, there are mechanisms for them to get answers. And I think in the COVID page, Dr. Foley want to talk about how they can get specific answers if a question is not answerable directly right now.
On both the coronavirus and the reopening page, there's a ask a question button in the top right corner where you can submit your question, and then it gets sent to the appropriate party to respond to.
Well, the next question is about parking passes. I know you have introduced some new innovations in tracking parking. Will there be a reduced rate for students? Will be mostly remote?
No, so the parking permit process will remain the same. So there's an option to buy an academic year pass, which is really a year pass because it goes September through August, or by term. So if you are not on campus fall term, then you may want to look at the pricing and decide if you want to still purchase an academic year pass or wait and buy a winter term and then a spring term pass separately. Prices will vary, so do that research carefully because it may still be to your benefit to buy the full academic year pass instead of 2 individual term passes.
The next question is about testing in terms of are we requiring everybody that is returning to the campus to be tested? Now, we have been in touch with other universities. This surveillance sample testing has been helping. The voluntary testing has been helping them, and it has worked well. Our hope is more of our students will take advantage of this testing options open to them for their own benefit rather than making it mandatory at this time. So it is not mandatory, it is voluntary. So anything you would like to add to this?
For students.
For students.
On campus.
On campus.
The first week or so, first week to 2 of the fall term.
Another question is about how is peer consulting going to be operating? I know, Dr. Marty, in your remarks, you said we can, as they have difficulties or challenges, or even if they perceive challenges, they should contact their faculty, the ROC or appropriate location. Could you comment on peer consulting?
Well, I think I'll pass peer consulting to VP Foley. We are going to be operating things like the ROC. We'll be doing in-person advising. We are using some small classrooms so that they can meet one-on-one and still have enough social distancing. So they won't be meeting in their regular offices. They'll be meeting in small classrooms. And Erin, you have more to talk about.
Yeah. So peer consulting will mostly be online. That's what we did spring term, and it worked very well for both campuses. There will be some in-person peer consulting. How that will look in terms of hours and which tutor can be available for which subject will still have to be worked out. But the online process worked very well, and so we'll continue with that.
The next question is about Southern Oregon being all online. Why aren't we taking the precautions and going online as well? Well, every university I know has made that decision with respect to where they are, what the incident rates are, what kind of curriculum is needed. And so the two major rural universities are rurally located universities, Eastern Oregon and ourselves. We are choosing to keep it mostly online because we know mostly on campus because that's what our students want and our curriculum, in particular laboratories. It was very frustrating for students as I spoke with them, and our faculty have really gone out of the way to help in so many ways. So it is again the factors I have mentioned before, our commitment to those students so that they can move forward and graduate, the reduced incident rates, the good communications we have with our health providers and other county health officials. So again, I should say, this is a situation that evolves. We will continue to adapt if things change not favorably. I think Dr. Mott has also already planned for first all the lectures going online, followed by only the health program labs being offered in person, followed by everything going online. So we have contingency plans. We will be looking at them. Is there anything you would like to add, Dr. Mann?
I think you've covered it.
Okay, good. The next one is about DRC. Will it be open for printing?
The DRC is open for printing now and will be for fall term.
The next one is about on-campus jobs. I know students are employed here. There are on-campus jobs. How does that work? And I know even in the spring, we kind of accommodated as many positions as possible so students will have opportunities.
Yes, so there will still be on-campus jobs in Klamath Falls for students. Maybe not the exact same jobs as we've had in the past because we may have a greater need for students to help with some of the COVID-related needs. But all student jobs will continue to be posted on the Career Services webpage through the Handshake platform.
Very good, thank you. I think the next one is about, do we have any metrics that are going to give us decision points at the present time? I know we do not have quantitative metrics guiding. It's something we watch, and we will be consulting a variety of stakeholders in this, including the county and state health officials. Even this morning, we are corresponding with, today or tomorrow, we are going to be corresponding with the governor's office on HEC on various fronts. So we are just tracking the conditions and we will decide appropriately. The next question is what will happen if a faculty member were to become sick?
The same as if we were not in a coronavirus situation, faculty get sick, departments work out how to cover those classes. So I don't think that is a coronavirus specific question. And again, it will be a case-by-case basis. There's the faculty member quarantined, but feeling, asymptomatic, and so would still be able to teach, but would teach remotely. Or if they are ill, we would obviously be working with the department chair to work out how to keep that class going.
Very good. The other question is, I know we have two major platforms, both Microsoft Teams as well as Zoom. This question is, will Teams be used for classes? I know there have been chat groups within classes using Teams as well. How does it work?
So, in the spring, the faculty used Zoom. It was set up, we bought the business version, and most faculty are pretty comfortable with the Zoom format. I know there's a move to Teams, and it may be that some faculty choose to work with Teams, but we're not going to mandate that everybody go to Teams at this point when they've already kind of got comfortable with using Zoom. And again, this may change, and I see Scotty over there going, we'll work with IT on this, but right now the plan is to continue using Zoom as faculty would like.
The one last question we can take, time is coming upon us. Does the daily health check include taking a temperature? I know there are self-assessments you are recommending to students, faculty, staff alike.
So the question asks, do you have a fever, I think is the wording. So most people know when they have a fever without actually taking their temperature, but if they prefer to take their temperature to answer whether or not they have a fever, they can do that. So it's really fever and about 4 or 5 other symptoms that will be asked as part of that daily health check.
Well, since the time is upon us, Maureen, do you have anything to add from a staff perspective? I know you have been communicating very actively with the university over the summer.
I would just say any employees who have questions that haven't been answered through emails, through forums such as this, to not be shy and reach out. If they want to do it without identifying themselves, they've got the options Dr. Foley mentioned earlier through the Ask a Question. Otherwise, just contact OHR, and if it's not a question for us, we'll get the question to the right department and get back to the employee.
Very good. Galen, do you have anything to add from a student health center? I know you folks have been very helpful to the students. I heard complimentary things on how you worked with them even during spring. Is there anything you wish to add?
I would just echo Maureen that if you have any questions, if you're a student, please give us a call at Student Health. We are continuing to offer in-person appointments for students with the healthy students in the morning and the sick in the afternoon per guidance, trying to keep and minimize the risk exposure. We also continue to have the video conferencing and telephone counseling sessions as well as in person. So if you have any questions, please don't hesitate to call.
Very good. Well, again, this is an evolving situation and we will continue to adapt. We'll keep everybody posted. Do pay attention to your emails and other communications. If you feel you have an additional question, there is Ask a Question button on the coronavirus page of our university. Do use that so we know what's on your mind and we can address the same. Again, this is a collective measure. It's a cooperation among everyone involved and our collective efforts that are going to help us navigate this new reality. And I am confident with everyone's cooperation and collaboration, we can make this work. So thank you very much. And thank you for joining today.